Good morning, my name is Martin Luther Negu Wake Up. I am a student practical nurse. In this video we are going to administer medication, topical medication. So before I start I will do my first check. So I have the medication administration record here and the doctor's order. So the doctor's order reads, apply Xenoderm ointment to right heel 3 times a day. So that's for my patient Stevenson Rogers, date of birth February 2nd, 1950, and the medication administration record also reads Xenoderm ointment to right heel 3 times a day at 8 o'clock, 1400, and 2000, so 8 in the evening. And this again from Mr. Stevenson Rogers, February 2nd, 1950. So I'm gonna go and perform my, so I will first compare the MAR with the doctor's order. So Stevenson Rogers, February 2nd, 1950, Stevenson Rogers, February 2nd, 1950. So Xenoderm ointment to right heel 3 times a day. Apply Xenoderm ointment to right heel 3 times a day. So now I will put away the doctor's order and I will go and perform my first check. So I will pull the medication from my drawer. So I have my medication. But before that, let me apply hand sanitizer and gloves, because I'm gonna manipulate. Perfect. So yeah, like I was saying, I pull my medication from the drawer. I'm gonna perform my first check. So the five right. So the right patient, Stevenson Rogers, February 2nd, 1950. Stevenson Rogers, February 2nd, 1950. So I have the right patient. The right medication, Xenoderm, the right route. So it's the ointment. So it's ointment. So it's topical application. The right dose. It doesn't mention here, but we the right time. It will be at 800, 1400, and 2000. So and so yeah, we had the right medication, the right patient, the right route, the right dose, and the right time. So that will complete my first check, and I make sure the expiry date is February 1st, 2024. So the medication is good. So now I'm gonna go see my patient, and I provide privacy, and I'm gonna go see my patient. Come. Hi, how are you? My name is Martin Luther. I will be your nurse today. Um, what's your name? What's your date of birth? 50. Can I check with you on your bracelet, please? That's good, and it matches with the MAR that I have here. Stevenson Rogers, February 2nd, 1950. That's good, thank you. So how are you feeling after your ostomy? You feeling a little bit better? The paper shows here that your pain, do you still experience pain? It says 6 out of 10. So probably the doctor will will give you some medication against pain. And I was looking at your vital sign. Your blood pressure is slightly higher at 145 over and 140 over 95, which is a little bit high. The normal is between 120. It's at 120 over 80. Your oxygen saturation is good at 95%, and your respiration rate is at 20 on labor and regular, so you don't use it's within the normal range between 12 and 20, and you're not using your accessory muscle. So as I was saying, the doctor asked, because you have pressure ulcer on your right heel, so we're gonna administer the Xenoderm to you. The Xenoderm, it's a product that will help heal your ulcer and your wound on the right heel, and it might have a little bit of side effects, so like stinging, for example. But if you experience things like rash, hives, skin irritation, redness, if your skin is peeling, do not hesitate to let us know. We're gonna talk to the doctor and see what we can do. Yeah, so and then the procedure, what I'm gonna do is I'm gonna expose your right heel, and I'm gonna try and wet that a little bit and wash it a little bit and dry it before applying the medication, okay? Are you okay with that? So, but before that, I'm gonna go pour the medication and prepare that and bring that over here before the administration, alright? So I'll be right back. So I'll come back here and pour my medication. So I have the cup here. I will pour the medication. So that's my Xenoderm. Pour that medication in the cup. And once I've poured it, I will dispose that. And then what I'm gonna do is I'm gonna transfer so it's the Xenoderm. It's for Mr. Stevenson Rogers, February 2nd, 1950, 3 times a day. So perfect. So I'm gonna perform another check with my my ma. I forgot my medication order. So I'm gonna perform my check with just 1 second here. Yeah, so the second check is Stevenson Rogers, February 2nd, 1950. Stevenson Rogers, February 2nd, 1950. The medication is Xenoderm. So that's my second check. So I have the right patient, the right medication. The right dose is 3 times a day. The right time is 3 times a day. The right route is ointment. So it's a topical medication. And the right dose is we're just going to apply just enough to be able to cover all the surface of the ulcer. So I'm going to I already pour my medication. That's for the second time. So I'm going to put that down on a tray. So I'm going to put that, I'm using this as my tray to get ready to go apply the medication. And I put back into the rest of the medication. So that completes my second check. So now before going to administer, I will do the third check, So my third check, because I'm almost at the patient side, my third check will be now. So I'll put that over here. Stevenson Rogers, February 2nd, 1950. Stevenson Rogers, February 2nd, 1950. That's the right patient. The right medication, it's Xenoderm. It's Xenoderm. The the right route, it's ointment. And then the right dose is just to put enough to cover all the surface of the wound. Um, and then the right time will be at 800, 1400, and 2000. So I got my medication, I put that on the tray. So I'm gonna go see my patient now. So Kong, I'm back again. So I got the medication here. But before proceeding, I'm gonna wash the wound. So if you allow me to open the wound, so it's at the right heel. So I'll just open enough to, and I'll try and wash. I'll use my right. Alright. Let's put that over here. Okay. Okay. I'm gonna wash your right heel. So the heel. If you can turn that for me this way a little bit. Right on. With a dry cloth now, I'm gonna try and dry it. Okay, so once I'm done, I will change my gloves. I'm gonna put some new gloves. There. Now I have my medication here, so I'm gonna take just enough and put in my hand. And I'm gonna warm it in my hand before applying. So the spot will be greasy after that. So just wanted to let you know. So, and then I will apply it in the way that the hair are growing. So I just apply it a little bit, just on the surface where ulcer is. So again, as I was saying, if there is any rash, any highs or any redness, so just let me know. So after applying, I'm just gonna dispose the medication, and I'll dispose the medication, and I'll remove the gloves, because the gloves are still greasy. And I'll put another pair of gloves, of clean gloves. This one's, use this one. So another pair of gloves, and I'll cover my patient. I'll bring the bed down and put the cold light within reach. So if you have any question, if you have any problem, just let me know, okay? So, and I'll bring the guardrail up, and then yeah, this conclude, and I'll fill the documentation right away in order not to forget. So the MA, it was administered, so I'll sign my initial here, and then the date. It was administered at 8 o'clock in the morning. So I'm going to come again at 2 p.m. to administer this for the second time, okay? In the meantime, if you need anything, so just give me a call. So yeah, this concludes the video of topical administration, topical medication administration. Thank you. Oh boy.